Hello, Roxborough, Person County, and the surrounding area. We're delighted to be here today with another community informational event from our local hospital, Person Memorial, and we're thrilled to have the opportunity to have a special guest with us and talk a little bit about the Hospitalist program at Person Memorial Hospital. With me is Dr. Mahesh Borhade from Person Memorial Hospital, and you've been here, doctor, for several months, and you're finding that people are friendly here, and you're liking what you find.
Yes, absolutely, absolutely. Let me begin this with saying, first of all, thank you for inviting me.
Thank you.
It's a great honor and a nice gesture for inviting me.
Thank you.
And like you said, I'm fairly new to this community. It's been 6 months. I, along with Dr. Patel, we joined the hospital as a hospitalist group, and Dr. Strawn and Dr. Budapati, they worked there for quite many years.
Yes, sir.
And it is a difficult job to fill into their shoes. They have worked really hard, but trust me, we really love this community. The people are so friendly. All my patients as well as their families, they are very, very nice and friendly, and so is the entire hospital staff. They're very helpful and friendly.
Well, we certainly want to welcome you, and we're
Thank you.
so thrilled that you're here.
Thank you.
And you have quite a resume of many achievements, and I was just going to cover you. You and Dr. Patel had practiced together previously in Fayetteville, I believe.
Yes, we both were at Cape Fear Valley Hospital. So
Pretty big hospital.
It is a big hospital.
Yeah.
It's a trauma level 2 hospital.
Yes, sir.
And it's almost 600 bed hospital. So we both started together in the year 2014.
Okay.
And we worked there until the July of this last year, 2018. So almost over roughly 4 years.
Yeah.
So I knew him from there, and we were almost 60 hospitalist group. So it was a pretty big hospital.
Wow, I'm telling you.
Yeah, but it was a good learning experience,
Yes, sir.
working in a bigger community and working in a smaller community. They both are different experiences, and I always believe every day you learn something.
You do.
Yeah, so that was a good learning experience. I am carrying that forward here.
Your beginnings in studying medicine were in India.
Yes, sir.
And I was reading a little about the school, Grant Medical School, and that is what I read is one of the oldest teaching institutions in all of Asia.
It is the oldest teaching institution in all of Asia, and as a matter of fact, when we were studying, there were many international students also studying medical education along with me, and it was a very competitive environment to get into medical school. Now, growing back in India, as you know, it's a populated country, but then we are set a goal by the family or our relatives. So I was told that I would have to become a doctor, and that's how I went in that direction. And then I had to work hard to get into medical school.
Yes, sir.
And I was very fortunate enough to get into Grand Medical College, which is a very good institution. So that laid a good foundation of medicine into me.
But your studies continued. You have a master's degree in several areas. What I read is molecular biology,
Yes, sir.
biochemistry, and
Yes,
a
sir.
master's in public health. And you also continued in internal medicine residency.
Yes, sir.
See, even announcers can't.
No.
Residency at Michigan State University.
Michigan State University.
Wow.
The city is Flint, Michigan, and the hospital is McLaren Regional Medical Center.
Yes, sir.
So you know, the after finishing my medical school, I while studying my medicine, I always wanted to know, what's the basic biological science.
Sure.
And there is no other country than United States of America, which has good, strong foundation in basic biological science research.
Yeah.
And that had always kept me and interested. And that's what motivated me to pursue a master's in public health as well as the molecular biology. And I was fortunate enough to come to Georgia State University in Atlanta, a very good institution. And I have been in the United States since 2002.
Yes,
But I
sir.
did my master's in molecular biology, as well as I did couple of courses in public health, and in between I worked as a research assistant at Emory University also.
Wow.
So that was a good learning experience. But then after getting the basic biological science research, I decided to go back into medicine again. And for an international student, we have to take an entrance exam, if you say. It's called United States Medical License Examination. So
Okay.
I did pass those exams, and then I was fortunate to get into a residency in internal medicine, where I learned the the patient care skills in a good hospital at McLaren Regional Medical. So that was for 3 years, and I finished my residency in 2011.
There are certain advantages that a hospitalist brings to a hospital because you're pretty much, you can see patients more than one time a day if necessary,
That is true.
and you're right there to help coordinate with other doctors and other people who need information and nurses, and it's a wonderful program.
It is. It is. If you look back, if you go back, previously it used to be a traditional practice.
Yeah.
If I go to my doctor will see me in an outpatient settings. But
Right.
then when I get hospitalized, the doctor will also come and see me or take care of me while I'm in the hospital settings. But lately, sometimes it can be cumbersome or tiring for the physicians.
Yeah.
And probably 25 years ago, they started a program called Hospitalist. And nowadays, Hospitalist, everybody's dream after finishing medicine is to go into hospital medicine rather than going to a primary care practice. Because hospital medicine, they are the physicians who are dedicated only in the hospital
That's
setting.
right. Yeah.
So if
That's certainly appreciated.
it is, and then that's helpful for the primary care physician also. But then basically you are giving your entire time
Yeah,
to the patient and the family.
right.
You are not seeing the patient only once, but you can see them 2 to 3 times in a day.
Right.
And you are updating or keeping the family members updated on a daily basis about what is the plan of action, what are the results, and what is the further medical treatment, if you see. So that can be very helpful. And if needed, we can always communicate with the patient's primary care physician, and can either gather history from them, or when we are ready to send patients home, we can give them the brief synopsis what had happened in the hospital.
Right. So and give a thorough breakdown.
Thorough
you
breakdown.
might say.
That is true. You're right.
A hospital like Person Memorial, where it's almost like a family.
It is.
It's people work together. They love each other, and they strive to be the best. And you and Dr. Patel certainly bring a wonderful part of that family, and to make it come together. We appreciate that.
Thank you so much. Thank you for all your nice comments. You're absolutely right. It's a family affair. Let me say, I always believe when we work, not only in medicine field, any field, it's always a teamwork. When we
Yes.
take care of patient, it's not only the doctors who take care of patient. It's everybody, right from the secretary
Sure.
nursing aid,
Yes.
to nurses, to support staff, dietary team,
Yeah.
everybody. I always, Dr. Patel, we always believe in that fact.
Yeah.
It's always a teamwork, and like you said, it's a family affair. If you see from administration side up to the physician side, everybody's aim is to give the best care to the patient.
The patient
Is the
always
center.
comes first.
You're absolutely right, and patient is always at the center.
Do you work in different areas? In other words, if you're needed in ICU or other areas, you're able to pretty much move about where care is needed or advice is needed.
Exactly. So at Person Memorial, we are a good hospital.
Yes, you are.
Ours, because sometimes people think Duke is close by. Why should we go to Person? But let me tell you, we have excellent cardiologist, Dr. Bradshaw.
Yes.
We have.
She's my cardiologist.
Oh, she is. She is wonderful.
Has my same last name.
I know, and then I noticed, there are. I have noticed, in a smaller rural communities,
Yeah.
The last names are very common,
Yeah.
But let me go back, let me tell you, we have a very good support. Dr. Bradshaw, she's Duke affiliated, as well as Dr. Mehta, she's from UNC. We have wonderful surgeon, Dr. George.
Yes.
Then Dr. Hargate is also a very
Yeah.
good surgeon. We have our orthopedics doctor, Dr. Seniki is there. And emergency room physicians, they are all trained, and then they are all experienced physicians. So I have heard, whoever I have seen, my patients, they have nothing but to good say about all the specialists.
Yeah.
Dr. George, everybody loves Dr. George, everybody loves Dr. Bradshaw. So if we can get the similar kind of services which they are getting at Duke, we are always happy and more than welcome for the patients.
Oh, I'm so proud. Are there any pieces of advice for avoiding a hospital stay?
Oh yes. Stay healthy.
Yes.
Basically, you have to take care. I have seen, life is becoming very fast. We are all stressed. We are always after something, but we don't care about our own body. And they say, you have to eat healthy,
Yes, sir.
work healthy, keep your mind healthy, and
Yes.
do not take stress, and physical activity.
Yes.
These are the more important things we have to begin with. But obviously, if you are taking some medication, be compliant with your medications. And sometimes if you are sick, you have to go to the doctors, and then if you need to come to the hospital, you have to, especially in the sicker season like flu season. But then healthy lifestyle is the most important thing.
You just brought up an interesting question, and I'll just throw this
Sure.
one in there. Here we are in February, and just this very week, there's been a tremendous outbreak of flu. It
It is.
seems to have gone a second, come back, and so is it still good to get a flu shot even now?
Yes.
Anytime.
Yes, anytime. And then, as you said, we have many flu patients,
Uh-huh.
We have many flu patients. As a matter of fact, this is the most busiest period. As a matter of fact, lately, over last 3 to 4 days, we have been noticing the Duke hospital, the bigger hospitals, Duke as well as the UNC, they are on what we call as diversion,
Okay.
They are not accepting patients, So the season is sick. I urge people, to stay healthy and follow with your, even if you are having a cold or flu-like symptoms, you have to go to doctor urgently.
Yes, sir.
And get yourself checked out.
My compliments to the emergency room at Person Memorial. My wife and I both have had to use the emergency room on occasion. Thank goodness not recently, but finest care. They are on top of their game.
It is. Not only the physicians, but the nursing staff.
Yes.
Everybody. At the end, our goal is to give the best care to the patient, and the family. And I'm certainly glad to know that you had a good experience.
Yeah, there's an old saying around here, it's better in person. Of course, they're talking about Person County, but it's also better at Person Memorial.
Oh, that's good. That's good. Good to know that.
Any final thoughts you have you'd like to pass along for anyone? Just remember, Person, when you start feeling badly.
Sure. No, I just want to, we wanted to come out and, I wanted to introduce myself as a part of being the Hospitalist group along with my colleague Dr. Patel, and we have 2 nurse practitioners who are very excellent at night time. They help us out. So, we will be more than happy to take care of all the community people if they need to be,
Yes.
and we have a good excellent support from the specialist staff. So just wanted just wanted to come out and give you our introduction.
Well said, my friend.
Thank you so
I
much.
appreciate that, and keep up the good work.
Sure.
And tell Dr. Patel we'll interview him sometime soon.
Sure.
And tell him we had a good time.
Oh, thank you so much. I did have a good time, and I certainly appreciate you guys inviting me.
Yes,
it
sir.
was a great honor.
Thank you.
Thank you.
All right. Roxborough, Person County, thank you for watching and listening to the broadcast on the radio. When we play the audio of this, we'll be on the radio too. And remember, it's better in person.
It's better in
Person Memorial Hospital. We appreciate this opportunity to share this good news, and it is good news about our hospitalist program and Person Memorial Hospital. We're so proud. It's a jewel in this community for sure.
Thank you so much.
Thank you so much, everybody.
Thank you.